Well, today let's talk about combined contraceptives. They are termed as combined since they contain both the hormones estrogen and progesterone. We'll first talk about the pills, and they come in form of a 30-day blister, and you take one a day. They work by preventing the release of an egg through ovulation, and they also thicken the cervical mucus, hence the sperm cannot pass. The effectiveness depends on the user, and with proper use, they are highly effective. And when I talk about the effectiveness depending on the user, it means that the person taking the pill should take it every day and at a given desirable time duration. The pill should be given on the 5th day of the cycle, and if it's not started on the 5th day of the cycle, you use a backup method for 7 days. A backup method is mostly a barrier method, such as the use of condoms and spermicides. When compliance is not adhered to and you miss a pill, you should take it as soon as you remember. If you miss 2 pills, you take 2 as soon as you remember and 2 the following day, then you go back to the 1 a day routine. If you miss 3 pills, you take as soon as you remember and use a backup method for 1 week. Ideally, one should be given 13 packs, that's a year supply, but in resource-strained countries, such as in developing countries, you find that the availability is limited, so one can be given a 1 to 5 month supply of the pills. When someone is in category 3 and 4, as discussed in my previous video, combined contraceptives should not be used. They are advantageous as they decrease pain, they decrease ovulation pain, they decrease the risk of ovarian cysts also, and they protect from iron deficiency, as they help reduce the period flow, and also some contain iron tablets to help restore the blood being lost. The major risk with the use of combined contraceptives is the risk of clots, which may cause deep venous thrombosis or pulmonary embolism. One may also experience headache, dizziness, breast tenderness, mood change, and nausea and vomiting can also occur. And if you vomit within 2 hours of use, you should take another dose and continue with the 1 pill a day. We also have the combined contraceptive patch, and it is a thin adhesive patch with both estrogen and progesterone, and the drug is absorbed through the skin. The patch is worn for 3 weeks, and on the 4th week, the patch is released to allow for menses. Always remember to replace your patch on time. We also have the combined contraceptive vaginal ring, and the drug is absorbed through the vaginal wall into the bloodstream. The vaginal ring should also be removed during the fourth week to allow for menstruation. Studies have shown that combined oral contraceptives protect one from ovarian and endometrial cancer, and the effect can last up to 15 years post-combined oral contraceptive use. If you are using medication, such as drugs used to treat TB, drug used in seizures, antiretroviral drugs, this kind of drugs may minimize the effectiveness of combined oral contraceptives, so the use of an additional contraceptive is needed. For example, you might need to use a spermicide as much as you are using a combined oral contraceptive.